Welcome, dear friends, to Cardiac Radio. Yes, and this is our anniversary program. Yes, throughout the day, you have been listening to several hosts, not all of the hosts, because we have been had many throughout the 9 years. Cardiac Radio, we have had over the 9 years more than 200 people helping us, from editors to people doing voiceovers to people doing the programs themselves to working on the behind the scenes of our platforms. And that's the secret to our success. And it's all volunteer based. We don't ask for a penny. We work the best we can with the resources at the Spirit Side of Virginia to sustain this effort at Cardiac Radio for 9 years. And the Cardiac Radio is here to nourish our souls. Yes, and not only for today, but for immortality, because the knowledge that we get here, the information, the instructions, they can be carried out to immortality. It's not about something we do just for today to survive. It's about immortal lessons. And today we're going to talk about, in our 90th anniversary program, mental health, especially during this pandemic. It has been tough on many people, and you know it. Has been tough on the people who get sick, has been tough on the family members, on those who pass away, because here at Cardiac Radio, we're talking about mental health at a broader aspect. We're talking about discarnates. In our mediumistic meetings at the Spirit Side of Virginia, we often receive patients, people who discarnated and were totally unaware of the passing, and they are still feeling suffocated because of the coronavirus, and they are still in need of being helped out in the transition to adapting to the spiritual life again. We need to help and support the families who stay, and it's about the people who work in the front lines. Not only the physicians and the nurses, the hospital staff and the clinics all around the world, but also the mental health practitioners. Spirit centers all around the world are doubling up in their services to reach out and talk to people one-on-one in our fraternal assistance, to reach out to the emotional chaos that many people are feeling. It's about despair, it's about fear, it's about the unknown, the uncertainty. There's so much to talk about. And there's the beauty of what is this for. So we have here today two friends and experts in these things that we're talking about. It's about mental health. Dr. Emma Bragdon, who has been working in the field of psychology and mental health and has been doing wonderful works, especially bridging up the physicians, practitioners of health, and especially mental health, with the spiritist hospitals in Brazil. There's much to learn from her works, and nowadays, that's what we want, more integrated way of dealing with our lives. And we have Karina Oliveira as well, who is in the field of psychology and has been working in the front lines. Yes, she has been working in a field hospital in Brazil with coronavirus patients, helping and supporting the staff and the medical team as well in this hard work, especially because Brazil is one of the top countries in the spread of coronavirus. So we have a lot to learn today. I see friends here before I open and talk to Dr. Bragdon and Karina Oliveira. I see Abby Share. Thank you, Abby, for being such a faithful viewer and listener at Cardiac Radio throughout these 9 years. Thank you so much. John De Rosa, yes, one of our hosts and friends, and Teresa Castro as well. Thank you. Daisy Gallen, our dear friend, yes, works in front of the cameras, behind of the cameras in so many ways. She's here with us. Thank you so much. Sol Souza, a big hug to you. Lu Nicoliello, a big hug to you. Nora Brazil, thank you, Nora, for being a host, for being a friend and supporter at Cardiac Radio. So, friends, make sure you ask your questions during this program. It's not no longer than an hour, so you have only 55 minutes to ask a question, and we will relay to the experts here. So I want to introduce you to Emma Bragdon, though she's not new to us. Hello, Emma. How have you been?
Vanessa, hello. Thank you so much for inviting me to participate, and happy anniversary. I'm so impressed you've done this for 9 years now. Congratulations.
Yeah. Thank you so much. And it's not the first time you are with us. And the secret to success is also guests like you. Thank you.
It's been a pleasure.
And Emma, you've been working so hard at imhu.org, especially, right?
Well done, yes.
Integrative Mental Health for You. And it's a website we want you guys to write down. imhu.org. Go there. There's so much to learn. And Emma, you've become acquainted with Spiritism. You embrace so much of it, and you became a big fan, and that's to say the least, a big fan, intellectually speaking, of the Spiritist approach to mental health. Would you like to share a little bit why you found out this, and you've been a great advocate of it?
Why I found out, or how I found out?
Why you chose to
why I chose
put on this and work at the level of advocating for it.
Okay, well, in some ways, I feel like it chose me. And I wouldn't say that to everyone, but I think you and your audience would appreciate that. I was shocked when I was in Brazil, and I came to know a little bit about Spiritism, and I thought, why didn't I hear about this in graduate school? And I've been involved with studying comparative religions for decades. Why didn't I hear about it then? And then I thought to myself, oh, I must have been sleeping. Something must have happened in the course. I didn't hear it. I don't understand. And then I realized people outside of Brazil and outside of a lot of the Spanish-speaking countries don't know about Spiritism. So I was actually asked by a friend to go to a center in Brazil that was dedicated to healing, and to ask if they might be able to help him because he was paraplegic. And when I entered into the center, I was identified by some mediums, and they came up to me afterwards and said, you're here because you're going to be a voice to bring Spiritism to the rest of the world. And I thought, who are these strangers? They're mistaken. I don't know what Spiritism is. This is all wrong. But I was deeply impressed, actually. And starting that night, I was spontaneously introduced to leaders in Spiritism who would invite me to come to Sao Paulo, to go to several centers or Spiritist centers, or to go to the Spiritist psychiatric hospitals. And it was a wonderful invitation. I said yes. I was very interested, and I became deeply impressed because I heard about, for instance, the successes in helping people who were addicts. This was in the main center in Sao Paulo, which is unheard of in the United States. We have such a poor outcome for working with addicts. And I heard, then I was able to be introduced and speak to people who'd been diagnosed as schizophrenic, but who were now not only leading normal lives, but leading exemplary lives. For instance, I met one man who had been diagnosed with schizophrenia, had then come into Spiritism, spent quite a bit of time deeply studying it and learning from the Spiritists through Fraternidade. And now he's teaching in university. A very, very bright man. But I mention that not because it's the only one I met, it's one of the people I met.
Mhm.
And I was also very profoundly impressed by meeting a man he didn't have any particular trauma early in his life, but he had come into a deep depression, and then he'd had some kind of symptoms that a psychiatrist said were associated with schizophrenia, and he should be in the hospital, but he went to the hospital. He didn't do well in the hospital, and he was feeling like rodents were crawling all over him, and he was hearing voices. And certainly in any hospital in the United States, he would have been labeled schizophrenic.
Yeah.
But eventually he got to a spiritist psychiatric hospital, and very soon after he was there, he was diagnosed by one of the medical intuitives as actually being a medium in the rough, as I call it. In other words,
Yeah.
he had the capacity to be a medium and to be a healer. And he needed to associate with other people like himself. He needed training, and he needed wholesome food and a community that would completely embrace him. And when I met him, he had not only been in the hospital for a while, but then had training and was now going back into the hospital to assist those people who needed healing. And he was being the healer. It was a phenomenal story for me and helped me to realize that the spiritists who are deeply involved with spiritism in Brazil can identify someone who has that capacity, innate capacity, but has not been able to find a community that would support it, either through their family or their religious community or their schooling or whatever. And so they really needed a kind of support that the spiritists know how to give, but people in the United States don't really know about it. So because I've been extremely involved with what's called spiritual emergency in our country, I recognized in this last story in particular that the man had been through a spiritual emergency, meaning he'd had many spiritual experiences, but he didn't know how to work with them, and that they weren't actually symptomatic of schizophrenia. And so with just the right support, he and his family went through a major transformation, and he had a profound peace about him, an excitement about life, a desire to be in service, a love of the community. And his parents just were tearful and saying, we have our son back, and not only that, but we have spiritism now.
Yep.
So anyway, that may have been a longer answer than you wanted, Vanessa.
No, it's better than I could ever imagine, I would say. Not longer, but even better. And I would say this for those who are watching us and listening to us, coming from a spiritist family, fifth generation spiritist, my ancestors, and Karina Liss is here, and soon we're going to open the lines because she's been in touch with our Centennial Spiritist Center in Brazil, in the countryside of Brazil. And the first waves of spiritists in our family were closely related to working on this obsession, which is about this spirit release therapy that we talk about, and how effective it is. So we would say the good news is we have several spiritist centers around the world, and like our center in Virginia and in DC, we have these obsession meetings, and we have been working with people at that end, and we see the results. It's like, it's not a miracle. It's just working with nature and learning about it. And Emma, you have been bringing professionals now, of course, not now because of
not flying.
But you want to tell a little bit about the program in which you bring professionals, healthcare professionals, providers to Brazil to see how it works in Brazil, in the hospitals, the spiritist hospitals.
I'm happy to speak about it. I did want to say also that because I was so impressed with spiritism, I decided to start this mainly online programs about integrative mental health. And one of the programs is live, and that's what you were speaking of. It's a live seminar for 7 days in Brazil, and it's only open to healthcare providers. So there have been people who have wanted to go because they just were more like a tourist, but we don't accept those. It's a very professional kind of meeting, and the hospital itself has said very explicitly, we only want to host people who are healthcare providers, because a psychiatric hospital is not a tourist event. It's a serious place, and people need some training in terms of interacting with the patients, and also interacting in a way that's meaningful with the president of the hospital and with the nurses and other staff. So I've been taking people to Brazil since 2008, and I'm now considered by the hospital in Goiânia as to be their ambassador. So if healthcare providers outside of Brazil who want to learn more about the care, they are asked by the hospital to contact me, and then I organize it, and it's all done in a manner so that we have the best of care, actually, and can, in a very organized and systematic way, visit with the group of mediums who do prayers for the hospital at large, also to several of the disobsession meetings, also to witness how some of the healing mediums are working with people doing the passes. And we not only can observe it, but we can then have time to ask questions. And we've been so beautifully received. I mean, it's really been tearful for a lot of people to just see the warmth and the love that has been offered to them right away. It brings tears to my eyes to even think about it, actually. So I think that's been one thing that has deeply impressed people about the hospital itself, is just how beautifully well received we've been and how open. But then we also go to several Spiritist centers. One of them is deeply dedicated to just doing the passes work, and they've been extremely successful with helping people heal from cancer. This is also in Goiânia. And we also go to a community center that is quite unusual in that they're exploring new things. So one of the last times I was there with the group, we met with someone who was doing a particular kind of work with the mediums around not only addiction, but people who were on the beings who were on the other side, who had died as a result of addiction and needed help to become liberated. So I can say everyone who's come with me has been profoundly impressed. But the biggest question for us is, how do we bring this integrative style of mental health back to our countries? And Europe and the United States are not at ease with bringing all of the therapies back. Mm-hmm. Canada is a little bit more open, but it's still quite tenuous. So people feel that they can bring some of the spirit of Spiritism back. Mm-hmm. They might be able to just be much more sensitive to mm-hmm. ways of working with people that work, that they learned about in Spiritism. They're certainly not given a certification to practice disobsession. We don't certify them to do the passes work. We don't offer any kind of certification that would give people authority to practice. In fact, we stress that most of the mediums working in the hospitals and also in the community centers have been working for decades together. And they work as a group. So we don't endorse people working by themselves. We endorse people working as they do in Spiritism, and also for free.
Beautiful. This is wonderful. And of course, we would need a whole other program to talk about the reasons why and the mechanisms of it all. But it's good for us, Emma, to to relay the message to the world. It's still we still have a lot of work to do. A lot.
Yes, but a vision, as you know very well, a vision has to come first. People have to see or imagine something that they want to go for before we can manifest it. And so that might be on its way. And I'm getting more and more invitations now, Vanessa, to
Yeah,
speak to certain groups internationally about spiritism.
yeah, nice.
So um, so I'm certainly not the only authority by any means, but because I was born and raised in North America and educated here, people may um, be drawn to the way I describe spiritism. And my prayer is always that I do it in a way that is authentic. But so so
I
anyway,
would,
I'm
I
happy
would,
to be speaking about it, and as you know, I've written a couple books and edited one book that actually is a collaboration with many spiritist psychiatrists in Brazil.
mhm,
The book title is Spiritism and Mental Health.
yes,
So,
I would say this: the vision comes from above. That we know. We don't need to be worried about it. and and we need to do what we need to do. Each one of us has their field of action, and we are interdependent. You have your work, and we're connected to you, and without our work, so it's like we all need each other to work in our own field that is interdependent, interconnected, in our uniqueness. Being a medium and coming from a spiritist family, and being also in the field of neuroscience and psychology, etc., in the United States, makes all of us, have our uniqueness. But before I relate to you a question that John DeRosa is asking, I want to ask our friend Karina Lisi to come here. Karina Oliveira, she has been in the field of psychology, but she's also a medium and she's a spiritist. And she has been in Cardiac Radio's team working to help us in so many ways on the behind the scenes. And in a beautiful project that we've done 2 years ago, concluded list the beginning of this year or the end of last year. Right, Karina? Welcome to Cardiac Radio in front of the cameras. How are you, Karina? Oh, I think we missed something.
Hello, friends. I'm fine, thanks.
All right. Yeah, for some reason, well, I didn't
I'm
hear
very
everything.
proud to be here to help you guys.
hmm.
Can
Yeah,
you hear me?
yeah. I mean, it broke a little bit, but we're gonna keep trying, Karina. Karina, you have been working on the front lines of the coronavirus. But before we go there, soon we're gonna talk about the current times. We were talking with Dr. Bragdon about the field of mental health and spiritism, obsession and disobsession. At Cardiac Radio, we use the very terms obsession, and you're a medium as well. Um, you know what it is, the need for groups to work on this spirit release therapy that we call disobsession. You have had experience. What would you like to share in that regard as we talk about mental health?
My friend, I've been working in this obsession for about 20 to 25 years now. I started very young, at the age of 14 and 2. And when we talk about this obsession, it's a very hard subject because usually people don't believe
Yeah.
What a shame.
Yeah, well, she was going to try to come back, but Emma, I want to relate to you a question by John DeRosa. What is the rough percentage of patients that have been through this obsession with the spiritual acceptance versus non-acceptance? Do you have the numbers? I don't think the hospitals have numbers like this in Brazil. When I visit,
No, in fact, that's one of the things that I have tried very much to move forward with is research. But um, I don't have the information to answer that. Maybe, Vanessa, you could answer that from your experience or from your parents and grandparents.
we don't have, if we talk about actual statistics, we don't, because, it's even interesting. There is a book that Dr. Marlene Nobre's brother, he wrote, and he has a little bit, it's a rough percentage in mediumistic meetings
Mm-hmm.
about how many patients in spirits, discarnate entities,
Ah,
change their heart. From that perspective, we have just that angle. And recently at Cardiac Radio, when we were studying the book Psychophonic Instructions, which is the result of these obsession meetings with Chico Xavier, at the end of the book, they have two major reports, 2-year report of how many spirits communicated, the categories, and the success rate in mediumistic meetings, like shifting their hearts to the good, like in terms of being no longer obsessors
mm-hmm.
or no longer being depressed, because depression is not a thing of the body. There are spirits who come, they are deeply depressed.
Yeah.
They're still anxious. They're still afraid. They have panic attacks in the spiritual realm. People think when they discarnate, they're not going to have it. It's a thing of the spirit. But from the angle of a hospital, a spiritist hospital, I remember in Belo Horizonte, one of the major spiritist hospitals in Brazil is in the city of Belo Horizonte, Minas Gerais. And visiting them and talking to them about statistics, they said, we have a little bit, but we don't focus on it. And they don't focus because they are not, we in Spiritism, we're not counting the numbers. Somebody needs to do it, but not the ones who are working with the patients. So maybe, Emma, it's going to take you and your team to do it one day. I don't know.
Well, we tried, and it was literally we had a whole research project written up by a woman who had been funded by the National Institutes of Health and had already done a study that was well accepted on Touch for Health, which is similar to PASS's. And she wrote up a very fine proposal, and I was delighted with it. And unfortunately, she passed away right
Oh,
after it was submitted to the NIH.
oh.
So one message we can get from that was it wasn't the right time.
Yes.
But we still have the proposal, and if there's someone who would like to step up to the plate and carry it through, the hospital I work with would be delighted to collaborate with the research. So we have the hospital, we have the proposal, we just need the leadership on the ground to do it.
Well, Dr. Alexander Moreira in Brazil, he has been a leading force in the world, even in the International Association of Psychiatrists, about this field as well of spirituality and mental health.
Yes.
Let's check it out with him and see, maybe bring him at Cardiac Radio one day and we talk with him about it and see where they are. They must be interested in that at some point.
I've spoken with him directly about the proposal. He knows all about it.
Oh, great.
But again, we haven't found the right person to do it or team. Yeah.
All right.
Yeah. So I appreciate the question. And I wonder to myself, as a North American trained in psychology here, our thoughts are, oh, well, in order to believe something, you have to see the research and it has to be published in a good journal. But that I do this because it gives us blinders too. And I had to open up and realize that if a researcher came to the door of a spiritist healer, and then another person at the door wanting to enter was someone who needed healing, the person who needed healing would be the one who was addressed first, because the spiritists have their heart open. They want to help people in need, and the research is not as important. So when I realized that, I was much more accepting, and it's been a frustration because I'd like my colleagues to understand more, but that's where we are.
But it's something to be done. And I think we got Karina. Karina, you moved to another country now. All right. Now
Is this sound okay, friends?
Beautiful. We can hear you. Wow.
Oh,
wonderful.
thank God.
All right. So you're talking about people. As you know, Dr. Bregden and I were just discussing about the much that is ahead to be done. Measures that we need, numbers, statistics to really relay the message to others. But there is what's happening. You are talking about as a medium, people that don't believe in what you're going to say.
Yes. Yes, people don't believe in us. And I think there are many resistance here in Brazil also to talk about spiritism and life after death and all these things that are not so material. I have trouble in college to talk about this. People don't accept my research. My latest paper wasn't accepted because of that. So here we have trouble too.
Mm-hmm, mm-hmm. And Karina, but on the other hand, you've witnessed in more than 2 decades working in these obsession meetings like we do here, and seeing people who are coming in with, mental health issues, and after spiritual treatments, these obsession meetings changing their lives, right?
Yes, I have seen many spirits who died in mental hospitals, talking about their suffering, the way they were treated there, and they were aware of all the violence they suffered and they couldn't express because of the mental disease. So for me, it was very sad to see and to listen to these spirits, because we see here in Brazil that this exists a lot. There is a lot of violence towards mental health patients. People don't believe in mental health patients, even if they are telling the truth. They are completely dismissed. People don't care what they are saying because, oh, okay, you're crazy. I don't care what you're saying. So it's very hard to have a mental issue, I think, in the world. And I think we need to help as spiritists and as mental care providers to help as much as we can.
Yes. So let us talk about now the current state of the world. Nowadays, we're talking about the pandemic, people being forced to social isolation, which is happening at some extent and not happening so much in so many ways in so many countries. And the mental health issues. Children depressed, anxious, not going to school, not seeing friends, being under the pressure of parents who are also under a super duper pressure. We're working, we're doing everything plus homeschooling, plus caring, if we're good parents, of course, because the other ones may not even do it. We know domestic violence has escalated, unfortunately, and there are so many things happening at that level. And I know you, Karina, have been working on the front lines. And we would like in Brazil, of course, you're in Brazil, in the state of São Paulo, in the city of São Paulo, we would like you to share a little bit of what you've been seeing and how you think the understanding of Spiritism would greatly contribute to minimize what we're seeing nowadays.
The hospital is very hard to work at. My longest shift was a 10-hour shift.
Oh my gosh.
And we can drink, we can eat, we cannot go to the bathroom because of the contamination.
Yes.
So we have to use all the equipment. And once you get in, you cannot come out.
Wow.
So you have to stay there for 10 hours in a shift. And for me, the first day was very hard because you see the terror in the patient's eyes. They look at you they are terrifying because once they are there, they think I'm going to die. There is no other way for me. So when you come to talk to the patient, I go with my professor in college. She invited me to work with her in this project. She's a psychologist, Rosie Pedrosa, and she invited me to go with her as an internship to work with these patients. And the first thing you see is that they suffer a lot. They are alone in a room that's very, very small. You have no windows at all. You can see the other patients, so you are like in a box,
Oh my
inside a
gosh.
box with a bed only, nothing else. You don't have furniture, you don't have anything because everything can be contaminated. So we can put anything, even something in the wall, it's not permitted. And when we talk to the person, to people, they are depressed. The very first days, 3 or 4 days after, they started losing track of time because they cannot say if it's daylight or it's night. So our patients, they started to get confused. So enhance the suffering because they are scared, and then they get confused because they lose the track of time. They miss the family a lot. So we have video calls for the family to talk to them, to see them. Some of our patients don't like to see the family because as they get emotional, their conditioning gets worse.
Wow.
So sometimes we have to think about this because if they get too emotional, they are going to have breathing problems because they
Wow.
start to cry. And we have to think all of this before talking to the family. And for several times, my professor had to hold the hand of a patient to prevent him to go to the ventilator because people get panic attacks. And if they get worse, they'll have to go to the mechanical breathing. So we have to take care of them emotionally so we can avoid this because it's horrible. They have to be sedated. And
Yeah.
once they are in the machine, it's very hard to come back. We had just a few patients that came back from the machine. And we have some moments there that I will never forget. For example, patients calling the families to ask for forgiveness
Wow.
because they know they are not coming back. So they call everybody and say, I'm sorry for what I have done. I will miss you. And next day, the patient is discarnated.
Wow.
So for me, it's an experience I will carry on as long as I live as an immortal spirit.
Yeah. Wow, Karina, as you were talking about this, I want to open a parenthesis. There are people, I'm shocked when I say this, who are saying that the coronavirus doesn't exist. It's an invention, and that it's a creation. It's something that is just to create fear in people. But you are there in the hospital and you're seeing it with your own eyes, and you're in Brazil. You're not in the United States. For
No.
people who talk about these crazy conspiracy theories. So, what would you tell these people who dare to say that the coronavirus doesn't exist, that nobody has ever died of the coronavirus? I even read a post about it. Somebody somewhere in Korea who wrote an article about this. What would you say since you're there on the front lines?
I would say that I am 100% sure that it exists and it kills you in a second. For example, we had a patient was there for 5 days with taking antibiotics and he was getting better. And one afternoon, we made a small video of him singing a song to send to his family. And 3 hours later, this patient was dead. 3 hours before, he
Yeah.
was singing, and 3 hours later, he was dead. Because it's in a second. And I've seen patients that it's so it's so fast when the virus really attacks a person that we don't have time to connect the patient with the machine. They die before they get intubated
Oh gosh.
because
So,
it's so fast and everybody runs and it's not enough time.
so Karina, you were talking about the emotional component, and now we want to go back to the topic of the spiritual part of it. You're a medium and you're a spiritist, and you know how spiritism can be so helpful at this moment. And I would even add something before spiritism, talking, reading some posts, talking to some homeopathic doctors. In Brazil, the homeopathic doctors have brought together, and they have a class action to help people that are suffering of the coronavirus, and they can have effective treatment towards it, something that is not happening mainstream, right, Emma? You've heard about it too.
I've heard about it. One of my colleagues actually is a psychiatrist and a homeopath, and also a student of Ayurvedic medicine. And she says that they have discovered some very effective ways of working that are really helping not only the healthcare providers but the patients. So I'm not at liberty to talk about it,
Yeah.
but all I know is that there are alternative means, and I know that the virus is virulent. It is deadly, just as Karina has been speaking. But at the same time, we have to recognize that it hits people who have a compromised immune system. So if I think some of the most effective therapies are building up the immune system so that if someone gets the disease, it doesn't hit them as hard, and possibly they can get over it um, if it does hit them. So anyway, it's wonderful that Brazil and the homeopaths there have a class action suit. I'm all for it.
Yeah, they do. And you know, now talking about the spiritist approach, Abby Sher, who is from the Spirit Side of Baltimore, is here with us, and she was born in Brazil. She came across spiritism, has been, you know, a member of the Spirit Side of Baltimore as well. And she talks about the efficacy of the healing, the passes, as we say in the United States. In England, we say healing in the spiritist movement.
Uh-huh.
And Emma, you've seen it, you've heard about it. Karina, you have your own experience. Karina, what would you say once you are on the front lines? If you have the spiritist take, How could it be helpful in the scenario nowadays, especially regarding the mental health aspect?
I think that if people had the spiritist view, it would be completely different, because I can see that in the patients. For example, the patients that have a religion, any religion, they deal much better.
Mm,
And we can have the mental health, for example, when we have video calls with pastors and priests, usually the patient gets better very fast if they have the support of the religion. For me, as a spiritist, it's a normal field to study, because as a medium, I can see the spirits working in the hospital along with us.
mhm,
So it's very nice to see, and they are in greater number than us.
mhm.
So it's amazing to see what they can do for these people when they are sleeping, because it's very hard also to sleep in the field hospital, because you have the lights on all the time,
Oh, wow.
because we don't have there is no way to turn the lights, only a part of the lights, or your room, because you don't have a room.
Oh,
It's the same light for everybody, so it's horrible to sleep there. And I see that their spirits, they have a great part in the healing of our patients. And when they ask us to pray for them, but as psychologists we cannot do that at the hospitals, because we are there as psychologists, so we are not allowed to pray for them. But we have people come from the video, from using the cell phone, to pray for them, and they feel much better all the time.
oh, wow.
The patients, they have this horrible fear of dying, that
Mhm.
we as spiritists, we don't have that fear anymore. So I think this would help them a lot. If they believe there is a life after this life, they
Yeah,
would feel so much better.
yes, exactly. And Emma, when I know you've been in touch with severe cases, like, I mean, when you were visiting Brazil and bringing the healthcare professionals in mental hospitals, and you've seen the cases of how effective the spiritist approach can be,
Yes.
especially when we talk about the use of simple techniques as the healing passes, these obsession meetings when you talk to the spirits that are attached to the person, right?
Yes.
Would you say, if we were able to use these techniques, just as a hypothesis, because we
Okay.
don't have it in the mainstream for sure anywhere, not even in Brazil, talking about the coronavirus, we know the root cause of all diseases are not in the body. So would you hypothesize that if we used this approach, we would probably have a quicker shift in the curve of the spreading of the virus or the
That's
recovery of
such,
the
that's
patient?
such an interesting question, Vanessa. And so much of the illness, I believe, is exacerbated by the tremendous fear people have. And I mean, to be in the kind of condition that Karina just described is horrific. And if you're sick and you're feeling bad, and then you're introduced to that, it's going to increase your fear and obviously increase your isolation. You're isolated not only from your loved ones, that you don't get any kind of touch, and then you also are isolated from nature. So many of the things that really buoy us up and make us feel good. So the direction we're going in now supposedly is to protect other people so they don't get the virus. But it actually takes away so many of the supports for the people who are ill. And my sense is that if people were able to have the healing passes, which again, you don't touch someone when, as you know, when you, with the healing passes, so it could be done even though the practitioner is not ill and the patient is ill. So it could be done safely. And my sense is that the connection that the patient would have would be healing in itself. The vibrations that they're receiving from another person would be healing. The knowledge that there are spirits that are also assisting them in their healing, all of that kind of connection could be extremely helpful. And it's hard to imagine a hospital really overrun with people being able to provide disobsession. But if that were possible, my guess is that that could also be a healing element that could be very positive. I just don't know how it could be.
Oh, I understand. But now you're making me think about, as we march towards the last part of our panel here, we want to bring the discussion about how spiritism can be helpful in the balance of the wellness of people, for those who are not in the hospitals, those who are at home, the families.
Yes.
And many people were like, oh, I can't stand it any longer, I'm going to the beach, and they forget they're risking everybody's lives, not only their lives.
Yeah.
So what can we identify as elements that can help their mental health stability, their wellness, overall wellness, for those who are not sick and are home or are working a few hours and mostly from home with their families? What can be done?
Karina, do you want to answer that first?
For me, I think the first thing to help is to pray.
To pray.
For your mental health, to pray. And I think Spiritism gives us a sense of discipline that we can't find in the world. A true sense of discipline. Because we know that this is going to pass, as everything is going to pass one day. So I think it gives us hope, because we know that this is just a phase that is coming to an end eventually. And I think we need to have discipline, because for me, Spiritism has taught me so much of discipline to do what we have to do at this time. And I think prayer is essential for our mental health, because we have to be connected with something that is bigger than us. You can call it God, or I don't know if you have another religion. But for me, we have to maintain this connection with everything that is sacred, so we can feel better and be a part of a community, even if we are isolated for just a moment. But I think we have to be connected in this sense of to be linked with the sacred and our community, because we have technology, so we can have video calls, and we can see everybody. It's just a matter of time.
And it's completely different, Karina, from the Spanish flu. When people compare, say,
Yes.
Now we have all these massive hospitals, clinics, everything has advanced so much. And we have internet to communicate with people. We have TV, we have cars. We are not really, 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 really isolated. So when I see people like, oh my gosh, I'm like, how can we complain? We have phones to talk to people all day long.
Yes.
And people who are the poorest, I've met them in the northeast of Brazil. They were living in a shack, but they had a phone. And they had a TV. You're not isolated, for real. And I want to say, before I pass the word to Emma, John DeRosa, last night he was inspired. We were talking about the importance of us praying, and he came up with these beautiful verses. We want to read. Spirit is prayer, because we're talking about, instead of going to parties, like Alabama students partying to see who gets contaminated first. That's a crazy thing. And John DeRosa is saying, a spiritist prayer party is what we would love to see, with just a few incarnates and many more discarnates that only a few can see, all raising their voices together to amplify the prayer powers exponentially. And when these many are joined together praying to the Almighty, it is rather evident that whatever is prayed for will eventually come to be. Thank you, John. He's become, as he says, the spiritist dog walker. Oh, John. If you have read it, it would sound much better in your voice, because he recorded the whole Spirit's book with Steve Shepard, and he made Kardec's voice. So it's not comparable. So Nora Brazil is saying, I second you, Karina, in your recommendations. Now, Emma, as we talk and give, would you like to give some, from the mental health perspective, your recommendations for those who are home and need to stay put regarding the pandemic? For the much you've come to know, what would you say to help them out sustaining some inner balance and wellness during the time of the pandemic?
Well, we can recognize throughout history that spiritual retreats have been a way for people to achieve more balance when they have lost balance, or to achieve a deeper communion with God or higher self, or whatever you want to call it, a deeper communion than they have had before, which enriches their life. So some people go because they want to attain balance, some because they want personal enrichment, or some perhaps because they want spiritual liberation, a kind of oneness with God that has been talked about throughout all religions. Christ certainly talked about communion with God. So it's something that is a universal desire, actually, to have that deep communion with God. And pardon me if I use a term that people don't feel comfortable with, but you can replace the word God with what you are comfortable with. So if we recognize that there is this yearning in everyone for the very depths of spiritual communion, and that has been achieved through spiritual retreat, through the ages, through millennium, people have isolated themselves so that they can achieve that communion. So instead of looking at, oh my God, I'm not going to have what I like to have. I can't go to my restaurant. I can't go out for coffee with my friends. I can't be with my friends. I can't get hugs. I can't maybe even buy what I want to buy in the stores. I can't do the things that I usually do. So that's a way of looking at it as deprivation. Mm-hmm. But there's another way to look at this, in that we have the potential actually for saying, wow, look, I have time at home and I can perhaps do the meditations that I haven't had time to do, or haven't given myself time to do. I can share how to pray with my children. I can be more involved in my prayer life and deepen my prayer life. I can go online and take courses, maybe in Spiritism or in some other kind of religious form that I haven't had time to do before. I can meditate more. I can ask myself, what is the most important thing in my life right now? What do I really want? We can reevaluate our lives, which is often what people do on spiritual retreat. So I'm all for looking at not the half empty cup, but the half full cup. In other words, what does this offer us? And some people, and they are courageous people, but some people would say, it's a time to also grow and face our fears, and maybe face our fear of death, face our fear of losing our loved ones, face our sense of inadequacy as parents. It's a time of that we can decide to grow. And there are people like Karina on the front lines who can assist us if we need special support in terms of understanding how we can work through those things that have been so difficult for us.
Wow.
So I just wanted, because it's July 4th, which is the day of celebrating independence in the United States, I just like to read a particular line that comes from a spiritual diary that I read every morning. And for today, one of the lines is, "The way to freedom is through service to others. The way to happiness is being in tune with God." And if we can, remember the way to happiness is being in tune with God, and we have that opportunity during this time of stay at home, and we can face the fears we need to. And like you are doing, Vanessa, you are working with Kardec Radio, and you're also putting out the Spiritist magazine. You are a model of being in service to others, and Karina as well on the front lines. So there are ways that we can also be in service to others, whether it's our children or the extended family or our community. There are ways we can do that even though we are locked up at home. And maybe it's just calling people, calling our parents, calling people who might be alone at home and saying, "How are you? How are you doing?" And creating some kind of connection for them. So in that way, we strengthen our community bonds, and we might be, in fact, moving towards a kind of life that everyone actually is longing for, where there is more loving connection amongst all people, independent of their religion or their sex or all the things that generally separate us. So that, that's a bit esoteric in terms of advice, but I hope that will speak to some people.
Wow, I have to say your words wrap up our program so beautifully. I have no other words to add but to thank you, Dr. Bragdon. Thank you. Thank you, Karina, for what you've been doing, for being with us. I think it's frozen. I'm not so sure. Karina, thank you, Karina. Thank you. Thank you for your time. Thank you for being here with us. And I will leave the last recommendations and the last words by Dr. Bragdon as our food for thought. There's a lot for us to do. But this is not over. This is just one of the programs today. We have programs until midnight today at Kardec Radio in this special anniversary, and we're dedicating to giving a hand to everyone, wherever you are, on the front lines, at home, suffering, or being happy, and you feel happy. Bring your happiness to the world. Karina, thank you, Dr. Bragdon, and thank you, friends, for being with us. Yes, as Nora Brazil said, mic dropped after Dr. Bragdon's comments. Until next time at 1:30 p.m., Naur Fonseca and his team comes to do a beautiful program about their retreat, talking about retreat, Dr. Bragdon mentioned, the Spiritist Family Retreat coming up next weekend, and they're going to do a special program today. See you in the next program. Thank you, friends.